Thank you, partners, for coming on the stage. Number 1 in the overall recommendations. Implementation of Article 8.5 of the Cross-Border Health Directive. 2, establish an EU platform on the societal impact of pain. 3, integrate chronic pain within EU policies on chronic diseases. 4, ensure that pain care is a part of policies and strategies on cancer. 5, initiate policy addressing the impact of pain on employment. 6, implement workplace adjustments for people with chronic pain. Increase investment in pain research. That was 7. And 8, and finally, prioritize pain within education for healthcare professionals, patients, and the general public. Those were the SIP partners' overall recommendations. Perhaps you might like to comment and to thank those who made a contribution and input into this result of our process.
Yes, thank you very much for wrapping up these 8 recommendations. I just want to reiterate, we heard it by both the MEPs, and many lecturers told us today that there is clearly a difference in the levels of competencies. And although this is a European meeting, we should clearly take away these messages to your national chapters, to your national organizations, and please get in contact with your local representatives, not only on a European level, MEP level, but also your local politicians. And I want you to share the principle that if you are a professional, if you are, for instance, from a pain chapter in your country, please get in contact. If it's not done yet, please get in contact with your patient organizations, because you have to unite all stakeholders to get successful, and then you will be able to create this environment also on a national level. That's what I want to add to these recommendations.
Thank you.
Yes, if I may, that cooperation between all stakeholders is so important. We experience this now in Brussels, when we are walking together and coming into the European Parliament, or coming into the European Commission, or coming into the departments. Everywhere, when you come together, you have one voice, and you're telling the same message to the policymakers and to the politicians. So please, on a national level, try and work together and make what we are doing in Brussels, make that also happen in your own country.
Well, I would say, I mean, of course, I do not want to repeat what has been said. I believe that if you are here, means that you are very sensitive to the topic and you want to make the difference. But, you know, we have also to be realistic. This is the top, the very, very top of the iceberg. And, you know, in order to make a change, really, at the last center in one of the European countries, of course, we need to have an effective attitude to ensure that others will understand that through this one, we can truly make a difference for our patients. So I really count on the fact that, let's say, all these recommendations are take-home messages that will be spread around, because then we have the chance in 12 months from now to really sit together and to see, once again, step by step, improvements and changes and other lessons learned that we can once again spread around in other countries as well. So I really feel that, you know, we can make the difference, but it's hard work and we need to be passionate for that.
I'm here just on behalf of my colleague Mariano Vota, who is the director of the Active Citizenship Network. And I just want to thank SIP for organizing such an interesting and important initiative. And we are very glad to be partner in this. Thanks.
Thank you very much. Thanks.
Thank you very much. And I'd say thank you to the partners of 2016, the ACN, the EFIC, Grünenthal, and the PAE. Thank you very much.